Hey. Hi. I don't know. I can't. I may need to leave and come back in. God, this is a real flower?
Testing, testing.
Hey, we got you.
Phew. I got on my personal computer because I know my work computer can be picky.
You scared. How are you?
Not too bad. How are you doing?
Okay, it's good to see you.
You too.
Uh-huh. Is Cody gonna bless us with his presence?
I believe so. Or text me right now.
Sarah, I think he signed into the wrong Google or the wrong Zoom one and I emailed him. So will you just shoot him a text message?
Yeah.
And we're already recording and transcribing, so
Got it.
we're ready to go.
Okey-dokey. There he is.
Hello.
Joel said he's
Yeah.
waiting to be let.
Oh, I gotta let him in. Okay, hold on.
No, he's here.
Oh.
What's up, dude?
How's it going?
Good, man. How are you?
I'm good.
It's good to see you guys. I've been thinking about this since Austin. Well, it's really great to have you guys here. It's awesome to have you guys here. So, you guys have a presentation and a little bit of a talk you're going to share with us this evening. Is that right?
Yes. I don't know if our executive director got a invite. I mean, I'm sure he's got an invite, but I think he's waiting to get let in.
Oh, okay.
Okay.
So I know you guys sent us a link. But he's like you'll hear it when he speaks. He is an absolute remarkable speaker.
Okay, fantastic.
And he's kind of helped build the infrastructure for us. So
What's his name?
Joel Hungate.
He's not in here yet.
Okay.
Does he have the Zoom link or is he working off the Google?
I don't know if he got an exact Zoom link. If I send him this one, will it let him in?
Mm-hmm.
Okay.
We got a weird echo going on, Jim. How's the weather in Indiana?
Got some tornadoes last night. I mean,
Yeah.
all is fine. One of our facilities had to open later today because of a power outage, but
Okay. You guys had some actual tornadoes though?
that's what the news said.
Yeah. Yeah, we had a couple warnings right here. I don't know that we actually had any, but got close.
Mm-hmm.
What did you say? That's not Why is there an echo? Yeah. Well, I have myself muted. Is it better now? Now it's not echoing. All right. You guys can hear me?
Yes.
And
What's your director's name again, you said?
Joel Hungate.
Hungate? Okay. All right.
Do you guys have any seminars slash conferences in the works?
Every weekend. Yeah, next I think we're in LA next weekend for a regional summit. I don't know what's after that. It's a long list. Take it 1 week at a time.
Yeah. Oh, there's Joel as Cody.
Hello, hello. Yeah, how
Yes.
interesting.
Hey, Cody, Joel, how are you?
Hey, fantastic. I'm trying this new name identity out here today. Fits nicely. I like it, Cody.
So, Joel, I'm Tom McCoy. Nice to meet you. This is Jen Pishko. We run the medical society and got to know Cody and Sarah. When was that, you guys? Was it 24 in Austin?
February, yeah.
And heard about their story and your story through them, and finally was able to culminate in us kind of sharing their work with the CrossFit world, and that's what we're here to talk about this evening. So I'm super excited to have you here because I definitely heard a lot about you and your passion for the work. And so I'm going to hand the floor over to you guys to let you kind of run with it as you will. But I'd love to start with, I know the initial inertia getting programs like this in hospital systems can be so challenging. So I would love to hear kind of the kernel of how those conversations started, how you developed a coalition and got the momentum to actually make it happen, and kind of take it from there. But I love to hear how you actually made it work.
Oh, fantastic. Well, what a pleasure, everybody. I'm Joel Hungate doing the poor man's Cody Baker impression. So by way of background, so I'm a biomedical engineer. I'm an executive director for Hancock Wellbeing and our employer strategy. So one of our healthcare administrators focused on all things related to the future of healthcare. And I think that's the key tenet here, is that when we get buy-in from a leadership standpoint, buy-in in what the future of healthcare looks like, and using our exercise physiology efforts and our integrated well-being campuses as the vanguard for what that looks like. What we noticed is buy-in at our leadership level, they were already beyond the sale. We were very, very fortunate that one of our executives who leads our oncology service line is an avid CrossFit athlete, Dr. Julia Compton. And she believes in the model, believes in the approach. We have our exercise physiologists, and we always trust our team, like with Cody and Sarah, to really bring to bear the best of functional fitness on behalf of our patients, on behalf of the mission, which is to create this infrastructure of well-being, which is what we'll talk about today. So for us, getting that momentum was fascinating because Julia was already doing it. We said, well, heck, wouldn't it be awesome if all of our exec members were involved in something? So we created something called Exec Club, where they all met and literally participated in a scaled version of CrossFit as their introduction to how this could be deployed and scaled to different patient populations and different levels of fitness, right? Once they had that aha moment of, wow, this is way more accessible, the clinically overseen version of this, it doesn't have all the boogeymen that I thought existed in this realm, that the science, the experience, the community, the accountability, that's what ultimately translates to the outcomes. So for us, it was an incredible opportunity to take that and then bolt that on, augment, inject the DNA of everything CrossFit and functional fitness represented into an already very robust well-being infrastructure that we put together. And that has since unlocked an incredible amount of scale and incredible opportunities in how the landscape of healthcare has changed. So with that, Cody, Sarah, I don't know if you had a chance to introduce yourselves while we were working on getting me up and running on the Zoom, but I'll kick it over to you for introductions, and we can do while I'm doing that, I'll pull up the presentation with disclosures and everything on that front too.
Fantastic. Yeah, Sarah, you want to go ahead?
Yeah, so my name is Sarah Hurst. I started with Hancock Health back in 2021. I started as an exercise specialist at our McCordsville site. And from there, we basically have the floor to kind of make what we want out of an exercise physiologist role. So we are working with patients referred in our normal clinical exercise program. And then from there, within that full-time role, we can kind of see the gaps and make fit with what services we think need to be offered. So I wasn't even there a month before I saw this CrossFit program, and I was like, I need my L1. So got that right off the bat and got involved with coaching. And then ever since, worked with populations from just your average Joes to people trying to make it to the Olympics to started a postpartum and prenatal program. So yeah, kind of have seen it all and have been in a clinical exercise supervisor role now for about 6 months, where I get to oversee all these programs from the prenatal, postpartum to longevities, clinical exercise, cancer fit, and the whole 9 yards.
Had you done CrossFit before you came to Hancock and saw the integration work some?
Um, I say a little bit. I did a little bit of NFL cheerleading and found it hard to get through 4 quarters of a football game. So I was like, I need to get in shape, and I kind of melted CrossFit into that regimen.
That's fantastic. Oh, cool. All right, Cody, you're up, dude.
Yeah, my name is Cody Baker. I'm a fitness supervisor at the Hancock Wellness Center in McCordsville. So we have 3 wellness centers. I'm at the middle one. So New Palestine, our newest, Greenfield, our firstborn. I've been the fitness supervisor since 2018, so going on 7 years. Sarah was actually one of my exercise specialists back in 2021. We hired her, immediately a rock star. But basically been leading a team of 4 to 5, depending on the timeline, exercise specialists who are full-time, kind of like Sarah says, geared towards clinical exercise programming, kind of as a staple, but also doing a number of varied appointments like fitness assessments, general population, personal training, a lot of just overall member engagement opportunities. And then in 2020, we started operating in a CrossFit capacity at New Palestine and in Greenfield as well. In 2021, we kind of launched a more formal Hancock Athletics. And then in 2022, we started getting to the point where we were trying to offer the same thing. We didn't have the same resources of space at our facility. So we ran like a modified CrossFit programming, just with the same fundamental program. Just obviously can't say that name when we don't have it licensed. But in 2023, we finally affiliated after we got a awesome space built out at our center. Kind of like a way more premier CrossFit facility in terms of what you would normally see like in a warehouse. But I've been doing CrossFit since 2019. I thought it was going to be a 30-day thing. I was like, oh, I'll try it for a month. My friends kept telling me like I need to keep doing it. I got humbled immediately after the first open workout. Kind of got addicted. Got my L1 end of that year. Started coaching in 2020. And then after 2020, I think I worked out 300 days a year CrossFit, and now not at that level anymore. But Sarah and I have our L2, the Austin CrossFit Medical Society, or just CrossFit for Health event, kind of cemented that this is the kind of space I want to be in. It makes the most sense for me. And it kind of plays to both sides of what we're doing, whether it be the CrossFit side of athletics, but also the employee, or not employee, but we use it for employee health some, the population health demographic. And then my dad joining CrossFit, I think 2 years ago now, 2 years and some change, and kind of being like a rock star just makes it all the well worth it. So
That's amazing, man. So I tell your story and the story of Hancock Health all the time, everywhere that I go. And every time I tell it, I can see people's mouths kind of dropping, right? Because they're working in these traditional healthcare systems all across the country. And they're like, what are you talking about? How did that come to pass? How do I make this happen? Because it's always like, well, we can't get buy-in. How you can't do this in a hospital system. We can't make it happen. I'm like, well, actually, there are people that are doing it. And so I think highlighting some of the key components of how you actually made this happen is something that I'm going to resurface as you're talking and as we get this back to Joel. But I think that first comment that you made, Joel, about how you went about executing this is that you got buy-in from leadership right out of the gate. Right. And having them drink the Kool-Aid, right, just makes your job so much easier than to disseminate this across the system because they have an inherent understanding of the value, right, of the efficacy of the benefit. So I think that lesson of, as Greg says, just come try it. Like it's really hard to explain, but once you experience it, that discussion gets a lot easier. So I just want to commend you guys on that strategy. It was very well played. And I'll hand it back over to Joel.
Oh, well, that is the perfect segue, because what I'm hoping to do today, we're going to dive in, and I want to give everybody on the horn here the ammunition to have the exact same conversation, because of the way in which healthcare has evolved to require a response like this, the way that the landscape has changed. And we've dubbed it in our neck of the woods the infrastructure of well-being. So you hear me say that a lot, and that is this integrated well-being, surround wellness approach that we've invested 9 figures into as a health system over the past 15 years. So we have over a decade of experience and data doing versions of this. But the time is now for everybody on the horn, that the idea and the role that functional fitness and CrossFit health play in all of this is a function of the landscape of healthcare being more challenging than ever. And you're offering a unique avenue that has incredible stickiness. Folks that get involved stay involved. It has incredible engagement, way further upstream than traditional marketing for healthcare happens at the primary care setting, right? It has an incredible opportunity to drive outcomes, because we're pulling the levers on actual basal risk, not just the symptoms of risk, right? The manifestation of problems, pain. I'm not chasing pain everywhere. I'm not reacting to issues. We're pulling levers on risk, and that's opened up the door for us to go really, really deep. So first and foremost, from a housekeeping standpoint, the disclosure side. So again, Joel Hungate, I have an executive MBA. I'm a biomedical engineer. Also, if you've seen me on Netflix, I do crazy adventure survival and mountaineering things. So I was on the show Outlast as an alpha adventurer surviving in Alaska for 45 days. So my conflicts, I was a principal and am an investor in Dari Motion, and I'm a biomechanist. So I do a lot of biomechanical research, and I'm a movement science hearted individual and a movement quality focused guy. So you're going to see a theme here in my conflicts. Dari Motion as a principal and investor, Kimmel Motion Analytics I own as a distributor of human motion capture technologies, and then Copilot Health is an AI platform working in specialty care, none of which we're going to talk about today, but I have an equity stake in all of the above. And by way of title, I'm Executive Director for Wellbeing and Employer Strategy for Hancock Health, as we mentioned. Cody, whom you heard of, I got all of his acronyms, incredibly accomplished and wonderful fitness supervisor, fantastic leader, helping us find incredible individuals like Sarah, no conflicts, and as he mentioned, fitness supervisor for Hancock Health, very similar with Sarah Hurst, rock star, incredible addition to our team, and filling a new role for us, which is managing the clinical exercise as her pure play function in Hancock Health. That's how big the program has gotten. And she has no conflicts to disclose as well. So I'm going to start us off, and we're going to blaze through some of this because I want to cover the landscape of healthcare quickly so we can get back and forth. Feel free to interrupt me at any time if there are questions. This is incredibly organic, and I want to make sure that if you got something and it's burning a hole and you just got to ask it, interrupt, say, hey, whoa, time out, throw it in the chat. We'll try to keep an eye on all of that. But I want to talk about healthcare and give you a healthcare story to really give you an idea that like the role that this plays in where healthcare has to go is imminent, and it's happening right now because of where healthcare is today. And then we can talk about this different story, which is where it's got to go, this infrastructure well-being idea. And then finally, CrossFit as clinical programming, why it matters now more than ever. So we're going to dive into all of that. We're going to get really practical. I want to arm you with the talking points and an understanding of the landscape so that you can do this in whatever capacity you're operating right now. So my challenge and ground rules for everybody today: reframe and expand your vision for what health and well-being and healthcare can look like. That's not going to be news for everybody here, but it'll come across in surprising ways. This isn't the typical medicine 3.0 talk. We'll give you a lot of data on that front too. Secondly, challenge your assumptions about what's possible in terms of partnering with a health system. Think opportunity surface area. That's the engineer in me. You'll have to deal with me getting all engineering on you every now and then. But the main takeaway is innovate where you are with what you have. And I'll say, here's my warning, be advised, we're going to use a lot of meme literacy to drive the point home. I love going back to Picasso, right? Art is a lie that makes us realize the truth. So in this case, heavy dose of memes in my presentation because it tells the story. We all know that. Which leads me to my first healthcare story. There's a large system in Indiana. If you don't know Hancock Health, we're here in central Indiana. We're a suburb of Indianapolis. is Hancock County, and we serve all of East Central Indiana. We're really a big enough system to be really, really interesting, small enough to operate like a family and do really innovative things. But this is a healthcare story that comes from Indiana. It comes from a larger system. We get grant dollars to do things all the time, and we think we're saving the world, right? And we had this one shared with me with permission from a CEO from this large system that was telling me the story about how they got this grant to offer pack and plays, child cribs to all new mothers in their entire service area. Anybody that needed one got a free pack and play because their infant mortality rate was through the roof. And they were going to do something about it. And they said, well, we can't just sit around. Let's get a grant. Let's fund this. And let's give every new mom a pack and play. And they were so excited. They had hundreds of these pack and plays ready to rock and roll, ready to line them up. So he wanted to hand out the very first ones. They had a mom come through, healthy mom, healthy baby. Wow, this is incredible. Ma'am, before you go, have we got a deal for you? Here's a pack and play. It's the safest way for your child to sleep. Here's all the safe sleep info, yada, yada, yada. And she says, you know what? I'm okay. And he's like, oh my gosh, this is why we have this problem. Why don't they understand? Please, ma'am, take the pack and play. What can we do to convince you? Here's all the data. Your child has a chance of passing away. The infant mortality rates are high if they sleep on their stomach, unsafe sleeping conditions, blah, 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 blah. Bludgeoned her with the science. And she's like, no, please. Really, I do not need this. And that is just a fascinating thank you, Sarah. I'm going to see if I can switch this. I don't know why we have the screen showing the notes on here. You'll get some of that on the side. But what was fascinating, they kept asking and asking and asking. And what kept happening was the lady, she said, no, I'm good. I'd like to go. Well, he followed her all the way to her car until he realized, well, she can't take this pack and play. She was discharging to her car. She had no home. She lived in that car. Where are you going to put a pack and play? Right. And healthcare is a horrible experience and typically a horrible user experience. And because we ask the wrong questions, because we dive into things that in this case, I'm going to try to reshare my screen so that you guys get just the screen two here. There we go. Try this. There we go. Hopefully that's better. Healthcare is a miserable proposition because we ask the wrong questions. Continually. It's what makes it so difficult, what makes it so expensive. It's because we built a system based on asking these wrong questions, based on reacting to things, based on making assumptions. And that's why we have such a horrible problem with sick care in the United States, right? It's frustrating, it's reactive, it's poorly understood, it's powered by the wrong incentives, but it doesn't have to be that way, right? And I firmly believe this. Every time we talk about this concept, the infrastructure of well-being, every audience, whether it's benefit advisors, whether it's employers, whether it's other health systems, whether it's all of us on the horn today, we're the future of healthcare. We're sitting on this call. We're sitting in the room. And we need everybody here engaged now more than ever because we got a big problem. And if you didn't know, the pandemic resulted in quite some changes in the health and acuity of our patients that are coming through. This is not going to be a surprise. You might have seen the data. 60% of adults are going to have a chronic condition. 40% got multiple conditions. $1.15 of every $20 spent on the planet every single year is spent on American healthcare. And on top of all of that, roughly, if you go to any employer who's the primary provider of benefits for most folks across the country, in particular in the commercial space, of course, 41% of those individuals with access to healthcare, with insurance, commercial insurance even, don't have a primary care connection. So multimorbidity is up, patient acuity is up, ultra high deductible plans are on the rise, and primary care connections are down. And oh, what a deal. The employers get to bear the burden of all this cost. That is a recipe right now, economically, for billions of dollars of medical utilization that didn't have to happen. And somebody's left holding the bag. And it's typically the employer. They bear most of that burden. But this is going on. It's a $4.8 trillion problem annually in terms of just healthcare spend. And here's what the patient thinks. They get struck with the stigma of all of it. And they think, let's roll for Brimley. And the one word, I got the diabetes, or they think, well, man, lifestyle change. Nah, that seems hard. Isn't there a pill or a big red lever? I can just hit the easy button, or maybe I'll just avoid healthcare altogether because I have a $13,500 deductible and I'm paying for it out of pocket anyway. Right. And healthcare's got huge problems, right? If you didn't know this, most health systems are essentially low to no margin healthcare offerings from an operational standpoint. So I say margins, never heard of her. And I mean it. At scale, the best systems may be operated at 2 to 4% operating margin. If they're lucky and you don't have scale, but you're an independent or a decently sized system, you're maybe operating at 1 to 3%. We do backflips if we hit a 3% operating margin. Most healthcare systems do not make money. In fact, they're typically investment entities that offer low to no margin healthcare. And that's usually surprises people because you think, wow, you got to pay all these doctors, you got to pay this. Well, it's very expensive to keep a 24/7 acute care hospital open. When your reimbursement's horrible, you get uncompensated care, there's mass consolidation happening. Legislatively, we're imposing price controls on healthcare, and it's naturally not a free market system because it is federally benchmarked against whatever the Medicare rates happen to be. There are policy headwinds that are affecting this. There are denials. And when I say denials from an insurance company, that is you provide care and then they refuse to pay it, not prior authorization issues, right? It's like going to Chick-fil-A and getting a number one, enjoying the heck out of that chicken sandwich and your waffle fries and your Coke Zero, coming back to the counter and being like, yeah, hey, this was awesome. My buddy here handles all my payments. And he says, yeah, I'm going to give you $1.27 for the drink. You can appeal for the rest, right? Thanks for the meal. That's healthcare all day, every day, twice on Sunday. Automatic down coding, service line competition, which means the most profitable service lines are getting pulled out of health systems into standalone facilities. And that's causing mass consolidation because it's hard to compete with an entity that takes only the thing out that makes money, and things that lose money hand over fist, but that we need access to, like labor and delivery or primary care. That has to persist because we have to keep the connective tissue together to coordinate care for patients. Otherwise, they're driving 45 minutes to have a baby, and that leads to more infant mortality. Public perception, bad data, commodity mindset, labor skyrocketing, this fee for service. And like I mentioned, it's a miserable consumer experience because the patient has to navigate all this nonsense. And in our neck of the woods, I'm not going to go into this, but we've got just a ton of legislative headwinds that are essentially price controls coming down on healthcare systems that threaten their nonprofit status. If they charge more than a certain percentage of Medicare. Well, if you've met a healthcare system, you've met one. They come in a million different flavors. There's massive systems, there's independent health systems like us, there's county hospitals, which we also are, there's critical access, there's rural. So not all health systems are created equal, but they're all heading towards the same destiny, which is you got to innovate or you're going to liquidate or consolidate. That's it. And that affects access for every patient. So right now, everybody's yelling about who drives the cost. So you got the policymakers, health systems, consumers, everybody's pointing at one another. Meanwhile, insurance, PBMs, manufacturers, assorted middlemen are over here, not having their day in the barrel just yet, although I'd argue PBMs and insurance companies do get their turn very frequently. But this is what the employer feels. And I bring this up, and I'm going to keep coming back to this because there's an opportunity with clinically overseen CrossFit in partnership with health system to directly contract with employers. And we're going to tell you what that looks like and how that can programmatically feel. So to drive all of that landscape home, healthcare, it's hard. Engagement, hard. Health systems are bad at engagement. And keep thinking, juxtapose this to what CrossFit is good at, right? Healthcare, difficult. Engagement, difficult. Consumer expectations have shifted. But at the very least, we might be able to say, well, heck, fee-for-service healthcare delivers on outcomes, right? Well, here's the current approach. And we've all seen it. We educate, we manage your comorbidities, we prescribe you something. We suggest you eat right and you move more. We hope you do it. And then we rinse repeat when you come back and you haven't complied with that recommendation, right? Womp womp. It doesn't work because we define success the wrong way. In healthcare, fee-for-service healthcare, we typically stop at the idea of care compliance. So I always ask people, is that enough? Well, let's see. When we think about socioeconomic barriers, isolation, lack of confidence, the stigma, fear, obesity, all the barriers that are social determinants, all the barriers that are socioeconomically driven, none of this has anything to do or is not going to be affected by focusing on just, did you take your medication or not? This is a lifestyle change. It's community, it's accountability, it's sustainable change. So we posit, and at Hancock Health, we're very big on this and have been fortunate enough to become international thought leaders in this idea of integrated well-being because we put our money where our mouth is. And we said, well, the definition's got to expand. So I'm going to go all engineering on you for a second. A multifactorial problem, which healthcare is, and health and well-being are, and always will be, it requires a multifaceted, multi-touch point. Really, it's probabilistic solution. That means I have to have small, positive, reinforcing behaviors and touch points that keep the flywheel turning towards better health. And I have to have access to that. I have to have infrastructure for that. I have to have programming for that. And it's got to be sticky, and it's got to matter, and it's got to mean something to the patient. So that infrastructure has to address these barriers. We got to think cross-functionally and collaborate and coordinate for momentum. But I don't want to manage your condition anymore. I want to take a prevention, control, and reversal mindset. So that's key, right? Because the health systems that start to catch on to this, that's where the magic is going to happen, because they can then ask the next best question. So in all of this, for us in our journey, as we found functional fitness inside of that landscape that we just flew through, the realization is that health is a means, not an end, right? In traditional healthcare, we have this assumption that, well, people want to be healthy because healthy is good. Well, they don't know what that means, right? Nobody wants to be healthy for the sake of health. Like, yeah, I'm healthy because I should be. No, health is a means to unlock life and experience, retiring without pain, picking up my grandkids, going on that trip, climbing that mountain, doing the adventure I'd always wanted, living the life I've always wanted. And that's key. And we know this from behavioral modification, that we have to get the motivation right. And that's where this idea of the infrastructure of well-being has found its way into our nomenclature, and increasingly as a model for how this story can be rethought. So with that, when we go into this idea of the infrastructure of well-being, I think it'd be good, I'll blaze through this part. It's a little background on Hancock Health, but our journey, as Cody was kind of mentioning, into who we are and why we're such a unique setting for CrossFit, and a setting that I think needs to be replicated, border to border, across the country, across the world. So our goal, we're aligned on that purpose. We are a local focused, innovative health system. We're independent. We're not a big system. We get to be proximate to the needs of our community, and we're agile enough and innovative enough that we can respond to them. Unlike most grinding bureaucracies that are health systems, they do expensive fee-for-service tertiary healthcare because that's where they make money, and they do the rest of the stuff to help you find surgery or help you find cancer care eventually. I mean, that's healthcare, right? Primary care is the funnel to get you to all the expensive stuff. So the idea for us is that we want to be the #1 health ranked county, really community, because we serve all of East Central Indiana now. And we want to be the destination and well-being system partner for the future of healthcare, which is reducing the total cost of care and elevating the prospects, both economically and from a health and well-being standpoint, for a community. So for us, we're a comprehensive health system. Happy to share the presentation. You can learn 3 things about us. Like I said, if the main takeaway is local, focused, innovative, kind. That's what we're known for. That's what we get to do. And we're an incredibly high quality hospital that's really engaged in the future of healthcare, investing in the community. Won a lot of awards for that. We're incredible quality outcomes. All the great things a normal health system would be like, yeah, we're awesome at healthcare, right? We're also part of the Mayo Care Clinic, or the Mayo Clinic Care Network, as one of the members, and a hospital that is a health network that is a referral destination for Mayo Clinic on that front. But all that to say, right around the pandemic, right at the onset, the end of 2019 into 2020, our history, we started in 1951. We launched the Surround Wellness model in 2011, and that's when our data capture started. We did the second medical fitness campus in 2016, which Cody was referencing, in McCordsville. And then we had this idea of we opened something called Gateway. It's low-cost labs, imaging, and diagnostics for access to lower costs, lowering the total cost of care with those modalities. But then we had this giant hole in our service area where we thought, heck, what are we going to do down here? And we had thought, well, do we continue to invest in this infrastructure of well-being, or do we have to really hunker in, turtle strategy, and revert to the old fee-for-service approaches because those made money, right? And remember, in the pandemic, it was a miserable time for healthcare because it shut down everything that actually had a margin. There's no elective surgery. Everything that we were doing, we were not getting reimbursed for, or was completely uncompensated, or you had patients coming in and dying of COVID or dying of other respiratory issues. So when we hunkered in and had to say, well, do we continue to invest in this or not? Or do we really have to figure out how we're going to right size and survive? Luckily for us, we chose investing in the infrastructure of well-being. So we built our third fully integrated health and well-being campus in December 28th, opened the doors on December 28th of 2020. And I give you this background in case anybody's interested to give you an idea on the form factor. So this is a 64-acre campus. This is a 125,000 essentially square foot facility, counting our shell space. This is what it looks like from the outside. I show these side by side. One of them's the rendering, one of them's the actual photo, and you really can't tell in some of these. It's fascinating. They did such a good job on the the design side. This is the lobby. And as Cody and Sarah were mentioning, we have a CrossFit space on kind of the upper right over there is our affiliated CrossFit and functional fitness space that's dedicated to the effort. But we show all of this to give you just kind of an idea of the form factor of what we're dealing. We have 3 of these facilities. And what's crazy is the volume at which we engage in well-being. And this is what made us an international thought leader. And just the idea originally is that right now, as of today, we have over 16,000 members in a county of 90,000. Coming into these facilities, 750,000 times or more. This year, it'll probably be closer to 1 million literal visits, like check-ins to the facility to exercise or engage with nutrition or healthcare education. And that's not counting our clinical visits, which would be about 1,000 plus patients that'll visit the facility 3 times a week for 8 weeks in our clinical programs. All of that is to say that these folks are cash pay, net 30, concierge membership model, dues paying members accessing healthcare in a membership capacity, much like they would a CrossFit membership. And they're visiting our facilities more than the rest of our health system combined. All visits across Hancock Health are less, or we're almost double. If we hit 1 million, we'll be double the rest of the unique patient visits across the rest of Hancock Health on average, in a facility focused on reducing the total cost of care, empowering people to take control of their health. And this is where it gets really cool. And we'll take a dive into how CrossFit is really taking this to the next level for us. Is that this entire medical fitness model is clinically overseen physical activity, nutrition, and healthcare education. And that integration with a medical director, with bachelor and master prepared exercise physiologists, and our folks that have our CrossFit certifications, group exercise instructors, all the way to clinical dietetics. All of this is embedded, plus all of our healthcare system things on these campuses, right? Direct primary care clinics, primary care labs, imaging diagnostics, physical therapy. We co-locate all of it to make a new home base for health. But the jewel is exercise. The reason to be there is physical activity, nutrition, and healthcare education. And that's what gets us into the clinical exercise program. And I'm going to pause here to talk about this a little bit and let Cody and Sarah add some color, because our clinical exercise program we've been doing for going on now, gosh, we're going to be knocking on the door of 15 years here soon. And that's an incredible depth and breadth of data that we can show how this works. But essentially, every provider in our system can prescribe exercise. With the click of a button in our EMR, they can prescribe exercise. And that comes in this flavor. If you enroll in our clinical exercise program, it can be prescribed for diabetes, prediabetes, cancer, cardiovascular disease, risk factors, hypertension, obesity, general deconditioning. So literally anyone that is hoping to improve their fitness and take control of their health can find a reason and a cohort to hop into of folks along a similar journey. And they get one-on-one or group-based physical activity, and we're going to come back to this, tailored to those conditions, and integrate into that group-based kind of consultation with medical nutrition therapy, depending on some of the pathways as well. We arm them with produce from like a food as medicine standpoint, $200 worth of produce for our diabetes patients every week that they can take and use in a teaching kitchen. It's an incredible, all-encompassing, wrap everything that we can around you to succeed for 8 weeks, 3 times a week. And we track almost everything you can imagine. So the objective baselines, midpoints, and exits, these are the kind of metrics that we're analyzing, whether it's movement screens, VO2 max, and that sort of thing, right? So we have taken all of this, and now you start to think about, well, heck, how do you handle that with 16,000 members and thousands of patients being referred in? And I think that's where, without clinically overseeing CrossFit, there is no way this program would have scaled. There's no way that we would be arming people with anything besides trapping them into only being able to take control of their health in our facility, because the only way to scale this otherwise would be machine-driven selectorized equipment where you hop on the conga line, and we've done this, and you go from machine to machine to machine and use your little Technogym key and you do your thing. And you do that. But the problem is you're not empowering the person to learn how to move better, to learn how to feel and program and do things in a setting that they can facilitate themselves even eventually. And you can't do it at scale, because when you start to think about a cohort driven component, so much of that is you're still kind of on your island. And this is where Cody, Sarah, if you care to speak to this and how the clinical exercise program changed when we added in clinically overseen CrossFit and our functional fitness components. I think that'd be fascinating for the group, because what I saw looking at the numbers, looking at the scale, is that we unlocked better outcomes, higher volume, higher stickiness for the folks that want to continue that experience after the fact and become members at their own expense.
Yeah, I think it became the aspect of clinical exercise program is great, but it's 8 weeks and it's still a short amount of time. And with that, the non-members that did that program, we have a good percentage of patients that do join from that, but then it became a kind of what's next? Like, yes, the goal of this 8 weeks is to boost their confidence within using equipment and just being in a wellness center in general. But having that option of a program like CrossFit or this group, so they can either go in a one-on-one route or a group setting. And a lot of them are just, I want to continue with this group setting. I mean, we all know the epidemic of loneliness, and now not only are they in this new wellness routine and feeling good and great, but they have a friend now that they made that is saying, hey, when are you going to be back next? And I think that is something huge that we've just implemented in the last year or so that we've seen in the program.
Oh, that's fantastic. Well, and Cody, I don't know if you have anything to add to that. The outcomes page right here is really what I think tells the tale of the tape. As we started to look at and track and trend data over the last decade and how that is changing programmatically right now, I think it's an incredible opportunity. Don't mind my children and other folks like coming in the background here. How that's changing fundamentally when we think about the stickiness. And it's not just that you document an outcome, it's that can you sustain that lifestyle change?
I think the biggest thing kind of tied to this is lately I've been real with people, and that the idea in 8 weeks you can't sustain like massive amounts of weight loss in a correct fashion. So, and I think the idea of the selectorizer machine is not as dead, but it's a useful tool, like in the tool belt if you're traveling abroad or traveling, going to hotel gyms. But what Sarah's kind of gotten to is that our join rate is exceptional. I don't know what the true numbers are, what we ran this year. The amount of people that stick with it after is one surprising, but I think it's just a testament to how we've changed from a, hey, here's a program we offer, here's some machines, you can go on them, to that 3-on-1 or group atmosphere. We as coaches, especially CrossFit coaches, or exercise physiologists in general, are doing thousands of mini CrossFit sessions basically in a 3-on-1 capacity, or we teach class regularly throughout the week, or we have like a clinical CrossFit kind of classes called longevity. It just shows you that, you may not be losing 2.5 pounds of body fat, but their weight may not change at all on the scale because they've gained muscle, they've done functional movements. Yeah. And then most people have never exercised in their life with like a barbell. And if you give them a barbell, they think they're going to get hurt. But just seeing the light bulb moment that like they can pick something up with no low back pain is, I think, monumental. And it kind of gives them some freedom back. And then I think our best referring members are the people in our clinical CrossFit or our clinical programs. So everyone knows they need to get in shape. It's really cool when people in their 40s, 50s, 60s are telling their friends in their 40s, 50s, 60s to also get in shape with them.
Yeah.
It's amazing.
Well,
Joel, before you run,
yes,
these numbers that you're showing on this slide here, is this just over the course of the 8-week clinical exercise program? And I think that point is really important to let sink home, that we're talking about 2 months here, taking an A1C from 8.3 to 6.8, a 10-point drop in systolic blood pressure, 2.2 pounds in 8 weeks. Okay, there are few to no things, right, in the traditional healthcare system that will deliver. And pharmaceuticals, for the most part, can't even deliver on this because people can't fill them and they don't take them. And so the fact that you've shown this level of engagement and return on investment in 8 weeks, I'm sure you have data over longer periods for those people who are committed, which we'll probably see in the future. But this is really, really impressive, everybody.
Well, I'm so glad you mentioned that. I mean, and that's the kicker here. To Cody's point and to your point, Tom, the idea of what can we actually accomplish in this short amount of time, and you bring up the pharmaceutical. This is one of my favorite factoids here, is that 1.5 percentage drop on the follow up for the 3-month lagging A1C. So an HbA1c, right? You would ideally follow them beyond the 8 weeks so that we could get a good measure of it. That change that we're able to accommodate in the 8-week program would qualify us in the FDA's eyes if we were a drug as an anti-diabetes medication. We'd be FDA cleared to be an anti-diabetes medication, right? And we're doing it with physical activity and nutrition at a cost point that is an order of magnitude below what a GLP-1 or a GIP/GLP is going to cost to get people to that exact same state. Now, again, we can have an entire conversation about the role that the anti-obesity and anti-diabetes medications play in getting the flywheel turning for weight loss, because they are incredible tools. I mean, there's no doubt they work and they work really well. The problem is, at what cost per percent body weight loss? And secondly, can you sustain it without having to spend $1,500, $1,200, $1,000, $900 even a month for the rest of your life? And being on it forever, let alone what that means to the rest of your cardiometabolic health. So there's that is the story, is that we help people enter this program. They'll enter it on average if they're diabetic at 8.3. They'll leave pre-diabetic or off their medications. Meaningful changes in blood pressure. And to Cody's point, recompositioning. We don't tell them the story of, hey, you're going to lose all this weight. We're going to turn that body fat into something that is metabolically better for energy consumption, right? Like we're going to turn that into lean skeletal muscle mass. And that's the power of the recomposition story, is that they're not focused on the scale. They're focused on how they feel. They're focused on the community. They're focused on the fact that they can, to Cody's point, learning how to pattern a movement appropriately. And I can do it without pain now. My gosh. And it's crazy when you look at the stats of as soon as somebody starts to have that musculoskeletal pain, and then you get the fear of running, the cascade in quality of life is enormous when you start to threaten psychologically mobility. And then that psychological mobility turns into psychosomatic limitations, and then it turns into real limitations, which are asymmetries and deficiencies and balances, and it turns into injury or the loss of your mobility down the road. But the tail of the tape for us was people that go through this program, 75% of them complete it, and 70% of those that complete go on to become members at their own expense. So no subsidy, no other thing. I mean, the stickiness and pull through is beyond anything we see in the rest of healthcare. And here's what's crazy. As we dive even further into the unit economics of the kind of impact everyone on here can have on healthcare, you are affecting risk in ways that most healthcare can't even dream about touching. So these are some of the benchmark data that we see. Happy to share these studies. In the medical fitness model, we see there's a really good one out of Canada at like 500,000 some cohort, looking at all-cause mortality and hospitalizations with this model. But one of my favorite ones to reference, because this is the whole point of our clinical CrossFit and functional fitness, is that it's only as good as the community that's going to support you, the programming that can scale with you, and your ability to sustain it and have it adapt and evolve with you as your fitness adapts and evolve along your journey, right? And my favorite takeaway is whenever I look at the total cost of care for an employer, and I look at a lot of medical spend because we're on the hook to help them reduce the total cost of care, it's not the optimal folks that are driving the savings, right? It's great because you're not spending more money on them, but you might not have spent more money on them anyway. It's kind of a causation correlation issue, right? We want to keep them healthy. If I can take somebody from a very high risk category in diabetes to just high risk, In some, like a recent employer, a trucking company that we're working with, that is $150,000 per year that they save on that member if I can move their risk strata down just one level. So I don't need you to go from couch potato to Olympic athlete or CrossFit Games athlete. I need you to go from couch potato to potato. And the data is there that shows that this works, right? This is the minimal effective dose, that initial bolus of gain that you see is a 50% reduction in mortality. And this is an old JAMA article from 1989, right? This is not new stuff. But it's incredible when you see the light bulb go on with an employer, when you see it go with our clinicians, with our leadership at the hospital. And then I show them this and I'm like, oh, and by the way, this has fundamentally upended the financials of our health system, because all of this that you'll see here, none of this requires insurance. I bill nary a single provider for any of this. It is cash pay, net 30. We provide an incredible service. They pay for it in a membership capacity or on a standalone programmatic capacity. Rock and roll, rinse, repeat. And for us, that's created over $65 million in long-term contract value. And from when we launched NewPal and launched with that, truly our first affiliated integrated CrossFit effort, we went from 900 members that we brought over in December 28th of 2020 from buying another fitness facility and rolling them over, to month-over-month profitability in that center in May of 2021, 5 months. And now we're at over 6,300 members just in that facility, 16,000 plus across all three. It's 200% growth, 170% growth in the annual revenue. Multiple millions of dollars of just found revenue. But as a health system, what's crazy is 60% of the people that walk in our door do not use Hancock Health for anything else besides our wellness center. So the value that you can create by partnering with the health system, integrating with the health system, collaborating in interesting ways, connecting the dots, building the muscle memory between a system that could be aligned in what the future of healthcare can look like, that they're not fee for service or bust, not ride or die for the old ways. If you find somebody that's innovative enough to want to work with you or integrate this into their practice, you create incredible value for them, because we're engaging patients so far upstream that no other health system can compete with the time and attention we get from those eyeballs. So from a marketing standpoint, it is a gold mine of inviting people to rethink health and choose us, because we're investing in them way before it gets big, scary, and expensive, right? And for us, that's turned into $25 million roughly of annual pull-through revenue of patients that choose to trust us. Heaven forbid they need something, we get it done, and then we bring them back to the home base for health, that is this integrated well-being setting. And for the experience has been great. I've included some of the questions that we ask on that front in the next slides. And the idea there is that it's real, right? This is one of the months where we surveyed the folks that had just signed up. Hey, do you or your family use Hancock Health for anything beyond this? And in this case, it was closer to 50-50, but it's usually like a 60-40 split. And when we ask that question again, 6 months later, it goes from 60-40 to 40-60. So that 20-point swing is real pull-through revenue to the health system. And it's individuals that are healthier, happier, more engaged with their healthcare proactively, because they're coming from a place where they're choosing to invest in this already. But if you take nothing away from this, here's how it has panned out for us in terms of the health of a community. We've gone in 2011 from the 27th healthiest county in Indiana to 3rd today. And this is in a population that has only gone the wrong direction in terms of socioeconomic affluence, because we're the fastest growing county in all of Indiana. And a lot of it is due to manufacturing and logistics jobs. And the folks that are moving in are blue collar and typically don't have the type of access that we have to healthcare traditionally. So in the face of differing demographic changes and diverse demographic changes, we've managed to go from the 27th healthiest county, and back then we were the 4th most affluent county in Indiana, to 3rd today. And that discrepancy in a highly obstinate, heavy smoking, obese, chronic condition laden population, this is a testament to what this kind of program can do for the health of entire populations. And it puts us in the top 4% in the United States. And we have no business being there. Like if you drop somebody in Hancock County, you'd be like, there's no way that this is true. But you can start to see it now that we're enculturating something different. And for us, that was a big realization. It's this idea that what you do every day, what everybody here is doing every day, it's not just a health and well-being at an individual level standpoint. It's an economic development issue. It's the strategic future of the workforce, the quality of place, the reason people say yes and stay yes to your communities. So when you create that muscle memory, that connective tissue, we started to realize this, like, oh wow, people will pay for this with the right story. They'll engage deeply with care in a way that is incredible at engagement. CrossFit, incredibly sticky, wonderful community, incredible support, incredible experience, all the things that healthcare isn't. We leveraged that into our healthcare story, and it made us incredibly powerful. It gave us a superpower. And with that's kind of where I'm going to leave the presentation here. I'll send the rest to everybody. But the idea is that when you bring it all together and you bundle this, you can start to do really interesting things beyond membership models for physical activity. You can start to meaningfully participate in risk. And you're already seeing this in CrossFit Health with the insurance component. You're starting to meaningfully participate in risk as it relates to directly contracting with employers and other entities. You can start to offer things that they didn't even dream were possible for their people at a price point that is self-evident because the ROI is undeniable. It's gone from soft, squishy green dollars over here in the wellness world to hard ROI, dark green savings. That employers can recognize, that people can recognize. And what we've done, we bundled it with direct primary care clinics. So I'm going to blaze through this part and open it up for questions because I know we're coming up on the top of the hour. But we realize that well-being for your people is well-being for the business too. And the story that we tell for everybody, this capitated story of directly contracting with a system, it's the membership model in a CrossFit gym, just for healthcare. So you're already executing on models for this. What if you invite the patient to other services inside of that and it's bundled around healthcare? Now, there's some stickiness here. You can't do direct primary care to Medicare beneficiaries and Medicaid beneficiaries. And yeah, you got to make sure that if you're a provider and you accept Medicare or Medicaid, you'd have to opt out to be able to do something like that. So there, make sure if you are a provider, do your due diligence on the legal side, because we've had to do backflips to make all of it work because of commercial contracts and things like that and federal contracts. But the idea is that you can get creative and create something that didn't exist before, and people will be willing to pay for it. I'll send the presentation. We've got more outcomes in here, testimonials and how it's changed lives, what we do from like a targeted follow-up standpoint. But I'm going to end on this slide right here. These best practices. You are the future of healthcare. Don't let anybody tell you any different. And exercise physiology, physical activity, functional fitness is a physician extender. And I know so many of you live that and believe that, but if you haven't heard that, you are. And it's the most effective physician extender that we've seen. And you can learn the world of benefit advisory employers, the language that they speak, and you can start to contract and create unique things in that space that open up opportunities for business, open up opportunities for new programming, open up opportunities for outcomes, because healthcare needs your value proposition. So share that vision and create multiple integrated touch points, create something new. And we're here to be sounding boards for that because it's working in our large health system setting. And it's so funny, we're investing in things to keep people away from what makes money for our health system. And our board of trustees, our CEO, down to our frontline folks, everybody believes in that because that's how it has to be. Otherwise, we'll never solve the problem. And we'll end up with a solution that is only sick care and it's only consolidated sick care for everybody. And the access will be horrible. But we all right now can innovate and do something different. So with that, I'll pause, open it up. Happy to answer any questions, dive into the chat, or if anybody wants to throw them out there, we are at your service.
Well, that was fantastic, Joel. I can't tell you how much I appreciate the time and the thought and the passion that went into the presentation. I think that the point that you ended with is one of the most important, in that I don't know that many people actually believe that you can integrate a proactive, health-minded protocol into the health system as it exists today. Yep. And the fact that you've been able to do that and garner support and do the right thing and make people less dependent on your health system, but make it financially viable at the same time and actually return value to the system is a coup beyond words. And I think what I would love to hear a little bit more about is your experience at giving counsel to other individuals who hear your presentation, share your passion for the work, want to try and have these discussions with, leadership individuals in their own hierarchy. Where do you start? How do you start to have those conversations and have them be a meaningful impact?
Oh, that perfect question. I start here. This idea that there are really two things that we started to think about as we were framing up that buy-in, framing up the right stakeholders, framing up the right story, to go from great idea and skepticism to look at the outcomes that this bore. And for us, you don't have to have three of these massive, 33,000 to 52,000 square feet of wellness type facilities to do what we're talking about. The programmatic muscle memory you can build, the connective tissue, the care coordination that can happen. That's where the power is. The power is the accountability and helping people say yes to functional fitness as a part of their medical journey. And for us, saying, when our providers started to see the outcomes that we could drive, they can't click that exercise prescription button fast enough. We have some that refuse to see a patient without clicking it, regardless of whether they're doing it or not. They're like, no, you need this. Everybody needs this. So they just click it. And they're like, we're going to follow up with you. You should say yes to this. They are so bought in because they saw the light bulb change in their patients' lives in something that they used to know have no power over. You are empowering providers by offering this sort of functional fitness overlay with a lever they just couldn't pull. They had to hope that the patient got engaged. They had to hope that the patient was motivated. And when you can create, all you have to create, that warm handoff between practitioner and this clinically overseen CrossFit health style approach of, we're going to take into consideration your physician's opinion, your physical therapist opinion, whomever that happens to be, and your conditions. We're taking that into consideration in building your program, and you're hopping in with us, and we're going to help you take control of your life. If you build that connection in that relationship and you make that handoff easy, you're 75% of the way there. Then it's a question of scale, documenting your outcomes, and creating new innovative exit ramps off that highway of health that we're creating. And Sarah mentioned some of those. Then you can get into interesting specialized populations like pre and postnatal. You can get into special clinical conditions like diabetes or weight management. The opportunities are incredible, and your ability to affect all of those it's right there. You're doing it every day. If you can build that bridge with the provider, that and tell the story of, hey, I want to work with you, a clinically overseen version of this, use your opinion, update you on the results of your patient, and keep you apprised of their progress and show you the results. Man, look out. It's incredible.
Yeah, it's such an important point. I think one of the biggest challenges that we have in talking about first having those initial conversation with healthcare providers between CrossFit affiliates is overcoming the misconception or the preconceived notion about the safety and the efficacy of CrossFit and what that actually means, right? And you guys had the benefit of having a level of integration, right, and certification from your leadership team that this was a way to go, and you had a communication strategy for a feedback loop that let those providers know that it was safe and effective, and they could see those numbers, right? So I think for all of us listening who are thinking about trying to develop a relationship, even if it's with a DPC clinic or with a health system, setting up those best practices in regards to communication, both with receiving and giving ongoing feedback of the patient journey, is invaluable. And I know that Cody and Sarah can be a huge resource here, right? Because they live that every day. They probably help develop a lot of those protocols and have to communicate with the physicians who are on the other side. And I think that's a huge, huge piece of this.
Well, and I'll piggyback on that very tactically right here. Something I would encourage everyone, the clinical exercise program, we'd be happy to give the blueprint for what that looks like programmatically. And then secondly, we charge for somebody wandering in off the street to do that clinical exercise program for 8 weeks, 3 times a week of one-on-one or small group based functional fitness training at $60. So major loss leader for us. But as soon as they say yes to a membership, they stay with us for 4.5 years. The length of engagement's incredible. So we know that we're betting on the come when they sign up for it. Yeah, we may offer it at a low price point right now. You don't have to do that forever. But when you work with a provider, if you say, hey, if we could create a clinical exercise referral pathway and I can offer it at this amount that is accessible to your patients, would you be willing to refer them to me? And then I'll show you the outcomes that we're able to achieve. And then once they see the kind of results that you can foster and they see a patient who's engaged in exercise in a way that they didn't even think was possible before and found a community to support them, then you can work them into your other membership pathways or create other avenues to where you monetize the relationship so that it makes sense for your business. But don't be afraid to offer it, to put a time bound on the program like we did. It's 8 weeks. And then after that, there's a decision point, and we see incredible outcomes in that 2-month window. It's just a wonderful chance where don't be afraid to take measured risk on those populations relative to your expertise, because you have so much more power than maybe you've even documented before. And I think the physicians definitely, in our experience, weren't aware of that until they saw the proof in the pudding.
Well, and you're asking CrossFit affiliates, coaches, and owners to bet on CrossFit and to bet on themselves, which I think is a bet that most of them are willing to take. And I'm still so impressed with the ability of Hancock in general to have the ability to invest in the future, both with the $60 membership and however many tens of millions of dollars that healthcare integrated affiliate center cost to build. I have no idea how you made that happen or convinced people. And I mean, I do have an idea after listening to you guys talk, but it is exceedingly impressive. And to have it turn into what it's turned into for you, I think is just such a wonderful example for everyone. Jen, I don't know if you have any other questions before we start to wrap up.
I mean, no, I was looking forward to hearing from everybody on this kind of call and the presentation to put bookends around the facts that we've kind of learned over the last year and a half to almost 2 years, in this thing. I think one of the really big things or things to think about is the way that populations are being affected through the work that you're doing, right? And if affiliates kind of theoretically are zeroed in just to the folks that come in their door and they're potentially hyper focused on, oh, I need one referral or this referral, but from a public health standpoint, right, like having an infrastructure created where you have improved the health of your county, right? Like that's changing. We're talking about like things that are historically, detrimental to the way that our human life is going to change and get better. So it's just really impressive.
Cody and Sarah, do you have anything else you want to add, or any pearls to leave other individuals who are kind of thinking about
I'm gonna double check the chat real quick.
jumping into this journey themselves, or how to start those conversations, or pearls on how to talk with providers? Anything that you want to pass on to folks?
I'll say one thing and I'll let Sarah talk about how she's, I think, got a lot of buy-in from the offices and doctors. But the easiest way is just getting people to come in and try it. I know that's the simple thing. Like, I didn't understand what CrossFit was until someone said, come do this.
We're just gonna get bumper stickers and let everybody go to doctor's offices, and hopefully that they'll just stick them on the cars and away we go. But we know that, right? We know the evaluation. We know what happens. We know the transformation. We've seen it. We've felt it. We are starting to deliver on the data that's meaningful, that can be a storyteller, like you had alluded to earlier, and in showcasing what can happen when you bring special populations or groups of folks just like in the doors and be an extension of clinical care. So
I like the idea that Greg Glassman said, that we are like the lifeboats that are kind of surrounding your communities. And that's kind of an easy way, as I've done the L3 study lately. You just see a lot of that in old writings and journals. And I think that's where we find the most buy-in, is like, you don't have to be a doctor to save lives anymore. So it's been nice knowing that you can make an impactful change for the people around you. So
good.
All right, Sarah, how do you leverage the physicians in the office to get on board?
Yeah, I can't even remember who said it earlier, but just the pushback that, you normally get when you hear the word CrossFit, and just we've seen it and dealt with it, and having those myths ready to debunk and honing into your own space and what holds you unique. You know, I kind of refer to our space as boutique CrossFit sometimes, and it's what works with us. Like, we have air conditioning and we have a guideline where you can't take off your shirt, and that just things like that that just really work well with us, and they see that it's really not that intimidating, and CrossFit is for everybody. And you know, like, just on the debunking myths, the doctors think right away that it's for a young fit buff guy, and I pulled the average age of our CrossFit athletes and it's 46. So just being able to back up the facts, and Jennifer, like you're saying, like, just get it through. Like, we know how life-changing this sport can be, but bringing it down to the real practical level and making everybody on board that it is for everybody.
Well, you just gave me a great idea, and I'm sure this probably exists, but I think having a list of, the top 10 misconceptions your doctor has about CrossFit, and then sharing that with affiliates. So when they hear those one-liners, they can say, oh, wow, that's a common misunderstanding. Did you know ... right? I think that would be a wonderful tool. So we may have to mine your brains for some of those things that you've heard and had to answer, so we can put that together for everybody. Well, I know we're way over time. We could talk for hours about this. We'll probably have to have you back again, Joel. It's an honor and a pleasure to meet you. Cody and Sarah, thank you so much for the work that you did. I'm just so glad that we've gotten to know you better and highlight, you in the newsletter this month. If folks haven't checked it out yet, I highly encourage you to do so. Cody and Sarah, I'm sure will make themselves available as possible to answer questions, and we'll try and be a bit of a firewall for you guys there. But I know that folks are going to want to poke your brains on best practices and how you've actually made this come to a reality. And Joel, I thank you for your passion, your leadership, and what you're doing. It's really a shining light, and as we say in the medical society, we're the tip of the spear and have been in fitness, and we want to be in the healthcare space now. And you've manifest that into reality. So I'm very proud of what you've accomplished. Thank you very much.
Thank you so much.
No, what a pleasure it was to share with everybody. And like we said, the door's wide open. We're all about spreading the good news and making sure that whatever version of this can exist with any of the affiliates and any of the communities. Yes and amen. So we're at your disposal, and it was such a pleasure. Thank you for having us.
Well, thank you so much, you guys. I'm sure we'll be in touch again, and have a wonderful rest of the evening.
Thank
All right.
you.
Thank you.
Thank
everybody.
you.